I was looking at the public health report for 2019-2020, produced by yourself, and within there it says that the county council is ranked as one of the most deprived out of the 26 two-tier county council areas across England, as well as 78th out of the 151 upper-tier local authorities. So, I mean, the report itself is entitled about investing in public health. I suppose we're in such an uncertain time at the moment, but I was just wondering what is happening in the current climate to make sure that we can tackle and improve the situation with health and well-being of Lancashire's residents.
Yeah, that's a really good question. It's a very broad one as well. Basically, what we're seeing is a challenge on our health and well-being, where the COVID-19 pandemic into a community or into Lancashire, which was already facing some challenges in terms of health and well-being. So what we're doing now in this current context is, whilst we are doing everything we can to prevent the spread of the virus in the community by all this lockdown and isolating people and keeping them most shielded, most vulnerable people shielded, we are also having to make sure that there are no other unintended consequences of people being locked in. So mental health is a big issue for us. We know that's already an issue. There's quite a lot of things happening in terms of people's mental health and well-being. We've also know that finances are an issue. So that contributes to our health and well-being fundamentally. So whilst we are working on the coronavirus epidemic in Lancashire, we're also making sure that some of our more vulnerable, but I am calling them more valuable people, are looked after and protected from not just the virus, but also the wider impact of what's happening during the pandemic. So that's broadly how I'd summarize it. Particularly protecting groups, homeless, children living in households with families working or families facing challenges. It's quite a lot going on in terms of the welfare of our society whilst we are fighting the virus at the same time.
How are services impacted more than usual because of that, if that makes sense? Are we seeing an increase in demand?
Funnily enough, the demand is going down, and that's been one of our concerns, because whilst it is important for the services to create the capacity for surge, so when people are becoming poorly or need to be taken care of for the COVID outbreaks, we had to prioritize services. So there's some of the usual. So we kind of prioritized more high risk groups and created the capacity for other things that aren't even more important than the COVID. But what we're seeing is in the NHS particularly, there's a huge capacity being made to be ready for the pandemic and the COVID surge. But we're seeing people not coming forward with chest pain and stroke, and they've got issues. So we are encouraging. Cancer is another one. Whilst we need to stay away from each other and the physical distancing and social distancing, it's also important to seek help when we need it, especially when we have symptoms like heart attacks and cancer symptoms. So that's been a quite nuanced messaging, because the overall message is, let's prevent the coronavirus spread by staying at home, protecting the NHS and saving lives. But what we're also saying is, when you need help, the NHS is still open. Our services are still there for people when they need it, although we are operating in the pandemic environment. So not every service is open. See what I mean?
One of the questions that was put by one of our readers on that subject was, there was a concern, I think people are concerned that if they do present to hospital with something that isn't coronavirus, they're going to get it when they go in hospital. What's the chances of that? What steps are in place to protect people, to keep people safe when they go in with, for example, if they go into A&E with a broken leg, how are they going to know that they're not going to come out with coronavirus?
There is quite a robust process that operates in the hospitals, particularly when people go in. If they're going in an ambulance, clearly before they go, they know what they're dealing with. But then people turn up the A&E, they're effectively triaged or screened. If you're showing symptoms, are you in for fever, cough, then they go in a separate way. And if you've broken leg, then clearly you've gone a separate way. But what we're also saying is, please use, and then there are so many other online options now, which is, it's great, I think, in some sense, because this is something that we never thought will suddenly have to come into play in terms of people seeking help online. So people are using services in different ways, and there are some, although overall it's pretty challenging as such with COVID, but there are certain things that have happened that are positive in being able to support people in different ways. So there is I would say there is enough protection in place for people who need to be seen for key things like broken legs and heart attacks and strokes. So I would encourage people not to put off from seeking help when they really need it. So the NHS is still there when we need it. Our services that are critical and essential are still there when we need it. So there is quite a lot of, and I'd really like your support in getting that message across as well, because people are scared coming into hospital seeking services because they're scared that they will catch the virus. Absolutely, there is a risk, but the virus isn't in the air, so to speak. It's on the surfaces. It is in the air when you're in close contact with someone who is coughing, but otherwise it isn't. So it's a very nuanced message, but initially, still, the overarching message is stay home, only come out if it's essential for work or food or medicines or health or exercise, which is really important. But the services are really, really there when we need it.
I'm really well organized.
It's something that everybody has been planning and exercising. This, we plan for so many emergencies. So we kind of have been through this drill in lots of different ways, although the scale of it is nobody's planned for this long. And, this is not like a big bang where there's a fire and we put a cordon around and then it's all it's all off, or even flooding. It happens for some weeks and then people go into recovery mode and clean up. But this is in a completely different scale. And I'm ever so grateful for everybody, particularly the members of the public, British public, us Lancastrians. We have stuck to the message. And that's the only way that we could have seen this flattening. We are seeing the curve flattening in Lancs. But it's not by magic or by any medicine or any vaccine. It's sheerly because people are following the advice, and thumbs up to everyone. But we're not out of the woods yet, and that's my worry as well. In terms of forward look, very, very fragile few weeks ahead, and we can talk about that. I'm sure there will have been questions on that.
We do. Yeah. One thing that I wanted to ask you on that subject actually was that we're noticing now that the police are reporting a lot more people breaching the lockdown. There's little gatherings taking place in parks. There's people having picnics by the river or whatever. People are just starting to relax a little bit more. What is the likely outcome of that, and why? What needs to happen before people can do the things that they want to do?
Yeah, really good question. Basically, we have been in a lockdown for nearly 23rd of March. So, 5 weeks, 6 weeks coming into. From someone catching the virus, becoming ill enough to go into the hospital, recovering or sadly passing away in certain circumstances, there is a 5-6 weeks time period. So we are now at the place where all the things that we would have done had its maximum suppression effect on the virus. So this is this is the most, this is the most suppressed state in a way for the virus. If we let off guard on what we've been doing, thinking it's all right to go out, it's very enticing, and it's frustrating as well for people to be indoors for most of the day. If we do break the rules and go out and start mingling between the households, especially now we know that there is a likelihood that some people may be carrying it but don't have symptoms, then the danger is that we will unfortunately start to see the cases rising and more people ending up in hospitals, which we don't want to happen. The virus is still dangerous. It's not like a simple flu. So that is what will happen if we break the rules. And I can understand the frustration, but it is worth it. Even if you don't catch it yourselves, it's our grandma and people that we look after that are more vulnerable, particularly the shielded population that we really need to protect.
Okay.
And also the NHS will soon be swamped. And we can't cope with the usual ones like the heart attacks and strokes and all that as well. So the impact could be huge if we don't follow the advice and stay at home and protect ourselves and the NHS.
Just on that advice, we're allowed to leave the home on a daily basis for a form of exercise. I mean, from your perspective, how important is it that people take advantage of this with obviously taking it into account social distancing measures at the same time?
Yeah. I mean, you mentioned that social distancing still is important, but it's incredibly important that we exercise. We get some fresh air. We walk. Don't have to be going in the car to some, favorite spots and things, but at least around the block. It's so important because the mental health and the benefits of exercise, not just physically, but mentally, our well-being. This is going to be a long haul, and it's really important to look after our emotional well-being, mental well-being. So that half an hour out is incredibly important for our well-being to go through, get through this period of time. So I would recommend everyone, even those who may not probably have been active like that before, now that we are in a lockdown, it's a wonderful opportunity to develop that and reset our health and well-being.
Sure. Health, well-being, mental health, and everything. We touched on it earlier about the likely implication of all of this on people's mental health, and this isn't just adults; it's children as well. These kids aren't at school; they're all in lockdown, missing their friends, missing their schoolwork. We know that mental health for children and adults is an area that's, even before this, has been stretched. What provision can be made really to deal with that issue moving forward?
Yeah, there's a range of things there, Rachel. The first one is, we can all go out at least once a day, or half an hour exercise, really, really important. The second one is, it can be frustrating for even those who can follow the advice and stay indoors for the whole day. I mean, I've got a couple of kids and they are incredibly bubbly and can't really, it's very difficult as a parent to actually support the children without taking them out and so on, especially when the weather is like what can. But on the positive side, on the other side, I am seeing like this Zoom and virtual ways of meeting friends and meeting relatives. Still, I think it's become more prevalent. So I've spoken to people that I've not spoken for months in this lockdown. But that doesn't really take away from meeting face to face and having a party and things like that. But if you look at it overall on balance, why we are doing this is the most serious thing that's happened to our health, our society since 100 years, since the Spanish flu, and in terms of the seriousness. But there are services. So if there is a need, this is what I was referring to before. We've now got children and young people's emotional health and well-being. There's quite a lot going on. and the services are there now. It's actually improved over the last 3-4 months. There's quite a lot of voluntary groups, again, remotely providing support. Support available for parents, support available for carers particularly. I want to pay a tribute to carers, particularly unpaid carers, especially, if you're caring for someone who has got a disability or a behavioral issue, dementia. You're locked in for such a long time with them. So I just want to recognize the role of unpaid carers in the county and pay tribute to them. But there is support available. It's not all locked down. It is, but when people need it, they mustn't hesitate. They mustn't delay seeking help, whether that is mental health, financial help, businesses. There's quite a lot that's happened. There's never going to be enough, but there's quite a lot that's happened to support people when they need the most.
Yeah. On that topic of carers, obviously the county council manages a range of care homes throughout the county, and the issue of PPE across the country is been spoken by quite in depth on a lot of levels. How is the county council ensuring that there is that proper supply for residents and staff, and will it also be taking up advantage of testing now that the government has given the go-ahead in that regard to residents and staff?
Yeah, actually, I'm very proud that we've taken a proactive step in Lancashire, and I include the members of the public and various providers in the care sector as well. On that, it's already a very fragile care system up and down the country, not just here. Because of a long period of time, this has not been looked after properly. What's happened now is the council is stepping in to support the care sector, care homes, home care. So we have weekly webinars with the providers. We have invested ourselves, along with the other councils in the area, to buy our own PPE essentially. Not just for the council staff, but for the providers, for the private providers in the county. And there is a system in place that they can email, and if there are any concerns that they can raise it. And we've got a system in place to basically provide the supply of PPE. We've also started recruiting care workers on behalf of the sector, stepping in and doing that when people report sickness. We've got support to manage any failure basically if somebody goes under, if any organisation can't sustain, there are mechanisms in place that the county council comes into the breach and supports the residents being cared for during that period. So we've done quite a lot of things in the breach in the meantime with the COVID, not waiting for all the national supplies to land really. So we bought millions and millions of pairs of gloves and aprons, and we've sourced our own supply essentially from China.
And is there enough? That's obviously everybody's concern.
There is, unlike other places, there is enough for the next 4-6 weeks, and there's another load that we are expecting, another consignment. And what we're also doing, exploring our own sustainable ways of sourcing locally. So there are talks going on with local manufacturers, suppliers. I think that's one thing that we will stand back or look back and say, that's well worth it. We sort of got stuck in and didn't wait for the government supplies to land, and we just got involved and sourced our own supply. For how long that will last, it's difficult because A, we are using more than we used to use because of the need, and B, people are scared. People working are very anxious in the front line, so they're having to be protected, and that's our top priority. That is our top risk and threat, is how do we protect the people who are protecting lives in Lancashire. So we're doing everything we can. There's never going to be enough of this, but for now we're on top of that. We're looking at sourcing local supplies. We're working together really like never before between the councils in Lancashire, with the support from the police. We've got military planners working with us. So there's some really top-notch people working with us in ensuring that we've got all the brain power going.
One of our readers actually on that subject, her daughter works, I think she's an agency worker, and she was asking what steps employers need to take to protect their workers. She said, my daughter works for an agency and the manager sent her to a care home without telling her there were 9 cases of COVID there. Now the mum is, she's vulnerable, she's high risk, and the daughter, she's claiming, has not really been assessed for the risk that's there. What onus is on employers to make sure that people are protected, that agency staff or new recruits are properly protected?
Well, ultimately, every employer is responsible for health and safety of their employees. They are responsible for doing all the risk assessment and all that, and protecting their employees with personal protective equipment and so on and so forth. I really hope that, well, I don't know the individual circumstances clearly, so I can't really comment on that. But I'm not aware of anywhere where people are putting their employees at risk by forcing them to go into a situation where they're not supposed to be. But if anybody has an issue in terms of PPE or raising concerns about a particular agency, we've got the contacts, so they can contact us. We can supply you with email addresses for that if you need. So I am very confident that we've got now mechanisms in place to pick up issues like that. But ultimately, we all should be aware of how to protect ourselves, particularly if you're working in a care setting. There are various requirements for PPE, masks and gloves and aprons and eye cover, eye protection, and so on. So I don't have a doubt on anybody in our patch that they will voluntarily and willingly want to put their employees in that position. So, but it is down to us as well.
If employees feel in that position, there's places that they can alert. Oh yeah. There's usual ways of getting the alert going, but also specifically for care sector providers on PPE and staffing mainly.
Just on my topic of keeping yourself safe, one of the main kind of industries that is kind of booming, if anything, is the takeaway food industry. I mean, it's a lot of people's highlights on a weekly basis, sometimes more than a weekly basis. How is the county council ensuring that stringent public health is taking place from the workers in these places? Is it even possible to do that without simply trusting individual businesses to make sure that sufficient safety mechanisms are in place? Because like we say, there are people in our society who are asymptomatic. Is it policeable? Is it not?
Well, it's a mixture of a range of things, actually, Tom. Essentially, they need to comply by law that whatever they're doing is safe, and their food safety and food hygiene and all that. They have got quite a lot of support in terms of information about how to conduct their business in that sector when dealing with people. Like, even if it's a takeaway, you don't let people in, and they need to maintain the physical distancing and all that. We, in terms of policing, it's very hard to police it in that sense. But our businesses are generally, they use the common sense. They're not willingly wanting to harm people, and we need live economy and successful businesses in the county. So we are relying on people's common sense and public sense of responsibility to some extent as well. But we do have trading standards. Our environmental health officers still are around, so it's not going to be free for all, and you can do whatever you want during this period. There are still stringent measures and advice and protection in place on particularly takeaways.
What the latest thinking is on masks. Obviously, they're needed in a hospital healthcare setting, but for Tom and I going to the supermarket, should we be wearing a mask? Should we not? What's the best kind of mask? What's the latest on that one?
Yeah, this is a real hot potato at the moment, because the science only takes you so far on this, and then the opinion is divided after that, even among scientists. In the UK context, masks have a really important role to prevent people catching the virus, and so that's why healthcare workers who are at the front line and care workers, we are asking them to wear a mask, especially when they're dealing with people who are coughing and spluttering, all that. However, it is common sense, if we cover our face when we are out and about, we don't cough. Whatever we do, we don't contaminate the environment. But there is a balance to be achieved there, that if you and I, who haven't got symptoms or who aren't working in the front line, go and stockpile all the masks, then our healthcare workers aren't going to get the masks. And there is a worldwide problem about sourcing masks in particular. I think what we will see is people will do I can already see some people wearing masks in shops, and we can't control that. But our science, and we've got top scientists in our country, are saying, look, the added value of wearing a mask from a point of view of preventing the virus circulating, on balance, we don't need to wear masks in the public, in Lancashire, in the UK. But it's a very fast-moving field, and I wouldn't be surprised in the next month or a couple of months, it becomes normal for people to cover their faces, but they don't wear surgical masks, for example. So I think but we need to be careful, because there are risks that we will have a false sense of security. So we wear a mask, and therefore we, touch our faces, or we become a bit less careful in our hygiene measures. And it is very hard to keep a mask for long as well. So it's quite easy to touch our mask, and even when we put it on and take it off, healthcare workers are trained to do this. It's not like you sort of get a mask and wear it. They're really trained to do this, especially when you take them off. You don't unintentionally contaminate yourself. So no to masks at the moment. For the members of the public.
Not for the public.
There seems to be a growing issue in recent weeks in regards to burning of waste and fly tipping across the northwest. But let's be fair, the issue is widespread. There's been a lot of instances of, especially in the South Ribble area, of burning waste. I spoke to a councillor in Hyndburn today who told me he's seen pollutants from fly tipping enter streams in his ward area. Obviously, at the current moment, the waste centres across the county managers are closed. Just on the issue of burning waste and pollutants in our environment, what would be your message to people who are thinking, I'll just dispose of a couple of tins of paint after painting the garden fence, for example? Because it seems to be a lot of reports of that type of waste in the vicinity, really. Yeah,
I mean, my message is, let's look after our environment whilst we are enduring this pandemic, and let's be responsible. Burning waste, especially paint, is harmful. And fly tipping isn't what we will do normally. So let's be responsible, let's be patient. And I know, you know, I've cut my lawn and the hedges, and I can't take them to the tip, you know, it's flowing and all that. But is it worth taking the risk and burning it and harming on myself and my family? But also, there's a reason why the waste recycling centres aren't open, and that is to maintain physical distancing and protecting ourselves and our family members from the virus, really. So let's be responsible. Let's keep looking after our environment. We are generally good. So let's continue that and just be responsible. Please don't burn. Please do not burn household waste in your garden.
Do you think on you mentioned obviously the reasons why they're closed is obviously due to not the issues regarding social distancing and whatnot. I spoke to one councillor today who says if Aldi can do it, why can't a local tip? Do you think if it could be enforced properly, that we would be in a situation where we could at some point feasibly let people dispose of their waste properly?
Well, at some point, maybe yes, in the future, but not right now. It is really, really important that we don't give the virus a chance. And that is the reason why we are in this lockdown and in this distancing and all that. There is a number, it's called R below 1. You will have heard about that in the news and media, which is how many people an average infected person can infect. And if you can keep that number below 1, we're basically stopping the transmission. And the best way and the only way we have is to spread ourselves out. So there's enough distance between us and we avoid non-essential movement. So this is all part of that strategy for suppression. Schools, public transport, pubs, cinema, all of that is aimed to suppress the transmission of the virus. So as we go into the future, if we have suppressed the R below 1 so much, let's say it's gone to 0.3, there is a room for maneuvering until it comes to 0.8, 0.7. So that is when we will start to see the lifting in various guises. But it will still be important to protect the shielded group. It'll still be important if you are symptomatic, cough and fever, you stay at home for 7 days, and if you're a family, staying at home for 14 days. And it still be very important to maintain the distance, the social distancing. These are the 3 main things that we've got in our hand. There's no vaccine, there's no antivirus, there is no treatment yet for this. So, yeah. You're breaking off.
Oh, sorry. Over the last few days, we're hearing about the Kawasaki disease, the inflammatory disease with children, that's thought to be linked to coronavirus. Is that something that's reached Lancashire? Is that something that we need to be more aware of? What can you tell us about that?
Yeah, basically Kawasaki disease and antiviral response in our body, our immune response, they share some characteristics. So it is scientifically plausible that coronavirus can present like Kawasaki. I'm not picking up it is a significant pattern in Lancashire, but it's plausible. I've read the recent reports, particularly in children, but it is one of the ways that the disease might present. So, and if they do that, there are mechanisms to identify and treat, or not treat, but manage the conditions. So I'm not aware of any specific issue that being a significant issue in Lancashire. I would be if there is. So I can certainly report that.
Okay.
On the issue of alcohol, a lot of people find themselves with a lot more time on their hands, whether that's through not having to commute back home from work, or being furloughed, or whatever the personal circumstances are. And social media is full of a lot of kind of challenge as well, of drinking challenges and all this for people to pass the time. Is the county council kind of expected kind of a ramp in alcohol and drugs help services after all this? Same with obesity as well. We've mentioned obviously the issue of taking advantage of our daily exercise. I mean, are all these kind of support services kind of waiting for a kind of a tidal wave, so to speak, or how is it being approached?
Yeah, there is, I share your concerns, and it is quite easy, isn't it? Especially if you can't go out and if you sit at home, there is a risk of us, every one of us, literally, but more people who are more vulnerable towards that develop that new habit, and just one glass becomes two glasses, and all of that. And what I am concerned about is this could become an issue in the next phase of the pandemic. We are already starting to see mental health, as we've discussed before, is a key issue during this. So it's not all just the virus; it's also the effects of the lockdown and all that. So, but we are on in terms of identifying who are the most vulnerable groups or people at risk of withdrawal and risk of being affected by alcohol. So the services are still open, but they're just being delivered in a different way. But it is possible that people don't seek help when they need it and then store them, and then there's a big balloon, there's a pile of people waiting, and then as soon as there is some kind of lifting of the lockdown, we will get a rush, and that is possible. It's possible risk. We are just monitoring that at the moment, and that's why my message is: if you have an issue, yes, we all need to be staying at home, but if you're concerned about that, the services are still open. It may be that there might be a delay because they are prioritizing preventing the virus transmission, prioritizing supporting them, people more in a crisis. But yeah, it is important to remain healthy and not get into the slippery paths of, for example, drinking every day and over the limits, particularly.
And for those who are already accessing those services that we say, are still running.
Yeah.
How has that changed? How are people's kind of?
Well, it has changed. It has changed in different ways. So people who have come for face-to-face are being sorted and addressed in virtual, like the virtual platforms. We are giving people longer duration prescriptions, so they don't have to travel unnecessarily. Telephone consultations. And there's virtual groups for peer support and all that. It's difficult, but people are still, services are still running, and we're doing different things based on what the needs are for our residents. Those are some of the ways that we've managed, particularly people who need medicines.
I've got a question from a reader here. It's to do with GP surgeries. She wanted to know, she said, my GP surgery has stopped all face-to-face appointments and changed them for telephone and video consultations. She says this has meant that she and others aren't able to access treatments like steroid injections when they have chronic pain. And she was just wondering when a normal service is likely to be resumed at the doctors, at the GPs. Yeah,
well, I don't know what normal will be. It's the honest answer. I don't think for a foreseeable future that normal will be what it was. But the services are still, so for example, there's a big campaign going on on cancer at this point in time. GP surgeries are open if there is a need for an injection like that, there may be a delay because they are prioritizing people with more serious conditions that the GPs wouldn't otherwise do. But they can still access the services. I don't see that we will ever go back to what was before. In both positive and there is a negative in that, as in it's going to be a prolonged plateau, and at least for the next few weeks. But there are positives also, in the sense that people are doing different things, and we're using different mechanisms to support people as well. The GP surgeries, the GPs are one of the more fragile areas in Lancs. We know that there are various things happening in terms of GP practices working together, and they are actually getting into hot hubs and cold sites and hot sites, and there may be a way that changes in the way that people access services. But people will get all these steroid injections and prescriptions and so on. It's just at the moment there is quite a lot of precaution in not spreading the virus, basically. That's why there is a delay. That's why there is a disruption in your normal service.
Okay.
On the issue of potential lockdown restrictions being reviewed from a national level in the coming weeks, as the current lockdown window would be set to be reviewed. If there are changes to policies regarding the likes of pregnancy, such as appointments and birth plans, what would be your advice to those who are expecting children from a public health and safety point of view? Because obviously you're caring for two if you're expecting mum, or three if you've got twins. So I think there'll have to be a lot of concerned parents to be out there wondering how to change their lifestyle when the government says it's okay to do certain things. What would be your advice from that point of view?
My advice is, whatever happens, we need to protect ourselves during this pandemic, and I'll be advising the usual precautions to take in terms of infection prevention, but also maintain social distancing. But people who are pregnant should be able to get the normal services that they would otherwise receive. So still midwifery services, still birth centres going on. There might be a change in the way where it's located to separate them from COVID-19 care areas, if you will. And I just want to wish everyone well, really, especially if you're expecting a baby. It's the best thing that can happen in one's life. Yeah, wish everyone well.
Okay. We had about care homes, about what the procedure is if somebody in a care home tests positive for COVID. Do they get put into quarantine? Should they be removed and put into quarantine? Should they be kept in the home? What's the best procedure? Obviously, we're seeing the care home figures rising now quite rapidly. So
yeah,
what's the situation there?
Yeah, it really depends on what the state of the care home is. Can they isolate people? Can they cohort people? Or what is the state of the people there are? Are they people with dementia, so they can't really restrict their movements and so on? Fundamentally, there's various things that are happening in care homes, from preventing new cases occurring to testing when there's case and isolating them. And even when people are being discharged from the hospital, being tested, and we'll be doing even more to actually keep care homes who haven't got any case of outbreaks or coronavirus remain so. And this is pretty much a live program of work in terms of preventing new care homes being affected, but also supporting existing care homes with cases in managing the infections and preventing new occurrences of outbreaks and so on. So only as of yesterday, there's quite a lot of capacity available for testing. So we're really getting on top of testing people with symptoms and trying to isolate them and so on. But still important to wash your hands. Still important to wear PPE if you're working in the care sector. Yeah, that's how I'd describe it.
Another of our readers has asked it sounds like a simple question, but I think it's not. They've said, why has Lancashire got the highest numbers of coronavirus cases in the entire country? Is there anything we can say in regards to that, in terms of the total number of cases for the area?
There's various things before we jump into conclusions about the numbers. I don't think we have the highest number of cases. Where did that come from?
Sorry, not the highest. One of the highest in the country.
Yeah. Okay. So basically, it comes down to a range of factors. Yes, we have underlying. If you look at pre-COVID times, like where we started, Lancashire is one of the places where we've got some health challenges because of underlying issues of deprivation, lifestyles, access, and so on and so forth. So it's not surprising in one level that we are one of the areas with higher level of virus as well. But it is also down to the number of tests. We really don't know per 100 tests how many are positive. We just know the numbers. So this will all be analysed, and there's various pieces of work going on nationally, and also it's down to how well we have followed the advice. But I can report that what we're starting to see is plateauing. So whatever we're doing seems to be working, and therefore it's important to continue at that level until we find a cure or a vaccine, or be sure that people who've got the virus are really immune. For a longer period of time. So it's too premature to say. The whole of the Northwest is after London. You've got the next set of higher number of issues, and that there are a number of factors, historical factors, underlying risk factors, as well as our behaviours, really, and the testing, obviously.
And speaking of, right to say that we're behind London in terms of where we are on the curve. Is it right to say that we're behind London by about 2 weeks? Should we be looking at what's happening in London as a taste of things to come here in Lancashire?
Well, it's a reasonable one to do, actually, because what we have found is there is a rough time lag of, like you said, a week and a half, 2 weeks before we started. So when did it actually start in Lancashire? Early March. So 2 or 3 weeks ago, it started everywhere else. Certainly down London, Midlands. So yeah, it doesn't always happen at the same time in every part of the country, and it is reasonable to assume that there is a time lag between us and some of the southern areas in the Midlands.
So would we need to have restrictions on for longer than what people are thinking?
Well, if it was just a natural disease, then I would say yes. But what we've done is, across the country, we've locked down at the same time. Right. So we've kind of artificially introduced a common timeline for all of us, if you will. But still, it is important, and that's really, really critical. It's important to understand where there are hotspots. So as we go out of this phase, what we'll be doing is managing mini outbreaks and containing, like when we started, like getting the cases, isolating them, getting the contacts, isolating them, home quarantine, testing. That's why this testing and contact tracing is all going to be very important in the next stage.
The subject of school and education. One reader has asked that how do they envisage children with complex medical needs returning to school once that is something that is given the go-ahead? Will it be necessary to put any additional measures in place to protect them if they were to contract the virus, or would they be, in another example, just not allowed to return to school?
Okay, as we go to the next few phases of this, first of all, when there's no other additional thing to do to protect people from this other than social distancing and shielding, really. It is too premature to say when the schools will open or reopen, because there are lots of schools that are already open for the children of essential workers and so on. And especially in this situation, they will already have a plan for that child that still is valid. So when it's a bit premature to even think about what additional measures, because we may have a vaccine, depends, but it's not likely to have a vaccine in the next month or two. So it is down the line. But we will also know more about the virus. So if it is particularly affecting certain groups of people, they may need to be shielded, and not even when things are open, they may need to be protected from that. So it's a very fragile situation, really, when it comes to the stage. We're not out of danger. We're not out of the woods.
And are the main symptoms that people are to look out for now? Are we still saying the new persistent cough and the high temperature? Because from what we're reading and from what we're getting from speaking to people, there seems to be a whole range of different symptoms that one person might say it's like jet lag, one person might say that the lungs were on fire. Are we still just looking at those two symptoms as quarantine?
There are. What we also know is there are some atypical symptoms as well as we've gone through this time period. But the most common symptoms are cough and temperature, and that's shared commonly, irrespective of what other symptoms you have. However, having said that, normally, if we are off poorly or feeling a bit down, it's really important to really look after ourselves, slow down, do whatever we do to deal with that. So that still applies. So if you are feeling unwell, you probably should take rest. And if you have a cough or temperature, it's not and, it's or, it's wise to get tested and stay at home for 7 days and household for 14 days. So as we know more about the virus going forward, we will know more about the different symptoms that people have. But yes, still cough and temperature are the two common ones.
Okay.
I'm conscious of time. How long have you got? I've got a 4 o'clock one.
Yeah, we can wrap it up in a few minutes. That's absolutely fine.
All right. Okay.
I'll ask one more question then. We've spoken about, obviously some schools are still open for key workers. We've also spoken about the need to sustain the economy as much as we possibly can. One reader has asked the possibility of people with small businesses sending their children to schools alongside the children of key workers, because at the moment she says that many are working from home while trying to educate their children at the same time, and it's having an impact on the health and well-being of both parties. Is that something to be a realistic?
You're breaking up, Tom. So what's your question?
Oh, sorry. Would it be possible for the children of people with? Can you hear me?
You're breaking up. Can you hear me?
Yeah, perfectly, loud and clear.
Okay, carry on. What's your question?
Is it a realistic possibility for children of people with small businesses to go to school alongside the children?
Oh, right. Okay. Wow, that's a really good question. Wow. I think at the moment, it depends on how we define essential workers, and that definition, I have to look into it. But talk to school. But the key one is stay at home when unless you absolutely need to be out, and that overriding principle applies. If you are able to work from home, I think I should consider that perhaps a safer option compared to having to go out, given that the virus is still out there. But if you have issues like mental health and the things that you talked about, there's always, common sense also need to prevail. So it's not like, people are doing their best to follow the advice, and it's not about over policing, and we need to take people with us, and it's going to be with us for a long time. And on that particular situation, I just want to refer back to the essential worker list, and then maybe discuss specific needs with the school. If they're able to accommodate, they will. Teachers are working very hard.
Yes.
Okay. And is there a final message? We're going to obviously wrap it up. Is there one final message that you'd like to give to our readers? What would you say?
Well, first of all, I want to thank everyone for keeping ourselves and our family members and Lancashire safe by following the advice. The second message is it's still dangerous. Therefore, we need to follow the advice of staying home, protecting ourselves and protecting the NHS. And the third one would be, if you have symptoms, or if you are affected and if you're now struggling to cope with the virus or other symptoms, services are still open, so you shouldn't hesitate to seek help, especially with mental health, but also some other physical health conditions. So, I want to wish everyone well, and thank you for the opportunity to speak to each other, and the work that you've done, and your interest, really, because there's quite a lot of fake news out there, quite a lot of armchair experts reeling away, and we need to take the public with us with the right information and the balanced information, and be as transparent, as we possibly can. So thank you for taking the time.
Thank you.
Thank you very much. It's been brilliant. Yeah,
very much. Very interesting.
I'm happy to answer any further questions. I'm sorry, I've got to go for another meeting at 4 o'clock. But if you want to, Stephen has the details, and it seems to work well, this technology. So thank you. I'm happy to do another one. I'm a Prestonian myself, so happy to contribute to the society and in every way I can during this period.
Okay. Thank you very much. Okay. All the best now. Bye.
Thank you. All the best.